We need to reintroduce ourselves.
All
Julie?
right. Hi,
Yep.
everybody. I'm Julie Flygare, President and CEO of Project Sleep, and really excited to have a conversation today, an update from Washington. And I'm here with Dane Christiansen from the Health and Medicine Council. Dane, you want to go ahead and say hi?
Hi, it's good to see everyone. As Julie said, my name is Dane Christiansen. I'm at the Health and Medicine Council, which is right here on Capitol Hill.
Awesome. So we are really excited and grateful to get an update on what's happening in DC. So with that, I think we'll go ahead and get started.
Great.
Dane, what
Thank-
exactly is happening in Washington, D.C.?
I was gonna say we normally call this a bit of a Washington update. We have a new Congress, we have a new administration. So every Congress and every administration is different, but it might seem like this year things are very different. So we're happy to give kind of a level set on everything that's happening from personal advocacy to with the administration and the agencies. I'll just mention really quick, I'm managing partner at the Health and Medicine Council. We are a nonpartisan firm, which is great because, nonprofits tend to work on nonpartisan issues. Their opposition is lack of awareness, lack of information, and the need to educate and kind of fulfill their mission with policymakers on the Hill. So it's a nice alignment. And we know, we have a lot of great advocates in the community that have been doing a great job sharing their story to do things like advancing research, facilitating treatment development, improving patient care and public health. And we are going to be in an environment where we can still do those things, but it's important to know what's going on at the 30,000-foot level as well. So I'll just give a little bit of an overview. I'll spend a little bit of time on this slide because there's a lot of background information. Um, so of course, we had an election last November. That election last November meant that there was a new Congress that convened on January 3rd of this year. That's all the folks that were elected. And then, of course, that was a presidential election year too. So the Congress, we have congressional elections every 2 years, and then we have presidential elections every 4 years. So now for the we have both a new 119th Congress and a new administration. And making things even more interesting, Donald Trump, who was the 45th president, was reelected for a non-consecutive term as the 47th president. So another thing that almost never happens in American life, but it has happened before. So, a lot of unusual circumstances coming together. But the new administration was sworn in on January 20th, and it's been about 6 weeks since then, but it seems like an awful lot's going on. And as we get into this, I just want to remind folks of a couple things that are kind of core realities of advocacy that haven't changed. And one of those is that everybody has a constitutional right to approach their government and make their views known. So as we talk about these executive orders and some of the other things that are going on in the administration, it's important to remember that this is confined to how the executive branch works and how agencies present themselves. It doesn't have to do with how you present yourself or, an organization or anything like that. So you have a right to free speech. You have a right to be whoever you are, and you have a right to approach your members of Congress and tell them things that you like, both challenges and opportunities. None of that is a little bit different. Another thing we'll mention in terms of kind of constitutional separation powers is who has the power of the purse. Constitutionally, this is the role of Congress. And it's in the Constitution that only Congress can spend taxpayer money. This will come up as we talk about some of these activities that have come out of the administration. And another thing, much less interesting than separation of powers and, your constitutional right to free speech, is something called the Administrative Procedures Act. So, whenever the administration can make rules and policy, but they often do this where Congress has not. And I think, as we all know from Schoolhouse Rock, if you want something to really get done, then you have to pass a bill. And the bill has to pass the House, has to pass the Senate, has to be signed by the president. But then it's kind of the law indefinitely moving forward until a different law is passed. Where there's a gray area, the administration can often step in and make some rules. But otherwise, if you really want to do something like the Sleep Act, you need Congress to pass a law about it. We'll talk about that a little bit later, but it's the same as everything else. And we do know a little bit about how Trump operates when he was 45th president. And there is something, sometimes things get put out that are meant more for media consumption than for policy consumption. And I think, one of those examples would be from today. There was rumors that there was going to be an executive order on the Department of Education. There were lots of news stories written about it, but then they said, you know what, we're going to just sit on this for now. Maybe we'll come back to it later. So there was a lot of talk about the issue, a lot of awareness, a lot of dialogue, but then nothing really kind of materialized. So I'll mention a few things that kind of made headlines like that from the start of the year. The first was an executive order that came out freezing communications. So when the new White House team came in, they said, we're going to clamp down on communications. We want to be very careful about stagecraft and our message. So the forward-facing presence from the government, we're going to take down some web pages. We're going to change how we communicate. Don't talk to Congress. Don't talk to stakeholders in the meantime. And then Congress very quickly said, oh, just take a pause on that. You have to talk to us. If we ask the administration for something, you must respond. But otherwise, there's a little bit of a grace period. Folks said, okay, well, let's see what happens as they kind of reorganize or redo their messaging. And as we've seen since then, web pages have come back up, communications have come back up, and there's been a thaw of that communications freeze. It's been a little bit uneven. Some agencies still are under it, others are not. But that's, kind of the status of what happened there. The second thing that happened was an executive order freezing all federal funding, saying the same thing. We're going to review how we hand out federal funds. Now, this was dealt with a little differently. First of all, it wasn't coordinated with Capitol Hill. It wasn't as if even congressional Republicans knew this was going to happen. A lot of members were at a retreat, and they started getting phone calls from their governors in their state saying, what about our money? Or defense contractors saying, what about our orders? And everyone started calling the White House and saying, what's the deal with this funding freeze? And even within a matter of hours, with these phone calls coming in from Capitol Hill, your elected officials, that we started to see a rollback on this. Oh, it's a misunderstanding. We're not freezing all funding. We're reevaluating this. And then there was another executive order that came out after that that said we're not gonna freeze all federal funds. We're just gonna scrutinize funding in areas that don't match with the president's values. And those areas were DEI, LGBTQ, foreign aid, and climate change. So if you were one of those programs, they might still be looking at it. But I think, as folks know, this raises a number of legal issues. A conservative government doesn't only work with conservative organizations, and a liberal government doesn't only work with liberal organizations. First of all, nonprofits are nonpartisan and non-ideological. Who's to say which is which? And also, we have things like equal protection and free speech. So if you're a judge, you have to unpack all of this and say, well, how does this line up with, rules and everything else that's happening? And there's been, of course, a number of lawsuits since then. And almost every one of these guidances has either been put under an injunction or a restraining order, as a judge kind of says, this isn't just, you can't really do things this way. And that was also something that would happen commonly under the previous term. And then another executive order materialized that had to do with NIH research not too long ago. And this one, I think, really kind of explains the separation of powers component and how the White House and the justices or the judges get along. And they put out a notice that said, we're going to redo how research is funded, and we're going to change something that are called facilities and administration fees, all the stuff that goes along with making research happen. We want to reduce this, which would disrupt medical research entirely. This was put out at 5 p.m. on a Friday. It was talked about over the weekend by, major news outlets. And then by noon on Monday, a lawsuit had already been filed and a judge had already put a restraining order on it. But the reason for that was that, Congress writes the spending bills every year. Congress decides how much money goes to medical research, and Congress even sets these F&A rates, as they're called. And they even have provisions in their spending bills that say the administration can't change this. So if you're a judge, you probably see a lot of tough cases and you have to make tough judgment calls. But when you're deciding if something is legal or illegal or constitutional or unconstitutional, and you're looking at a bill passed by Congress and it literally says, this is what Congress is doing and the administration can't change it, it makes it a little tough for the administration to release a policy that says we're changing this. So it's a lot of uncertainty, a lot of confusion. But things have been normalizing in recent weeks and kind of getting back to their regular cadence. NIH is funding research. Folks are doing meetings, and there's been some semblance of normalcy, but a lot of headlines that sow kind of chaos and confusion or uncertainty. Similarly, Congress is doing their work at the same time. And Congress is working on a few important things too. And the new Congress, the 119th Congress, has 65 new House representatives. So a lot of new House representatives. This is close to 15% of Congress in the House is brand new. Also, 10 new senators. There's 100 senators total. 10 of them are new senators. So a lot of new folks. Education's important. Awareness is important, but particularly when you have new members like this, making sure they know who you are and they know your story and they know why they should support the community. These folks are dealing with some very immediate issues, though. And I do know it often seems like Congress can't get anything done because the tension and the partisanship and the divisiveness is what tends to make better, kind of media stories. Congress does work in bipartisan areas regularly, even when you see something like the joint address last night where Democrats and Republicans, either cheer or boo at what they do or don't agree with, at the same time that was happening that night, earlier in the day, they'd passed a bill on flexible coverage options for people with chronic disease, and they passed it unanimously. So even though it appears there's a lot of partisanship and polarization, they do come together, and the system does work on those nonpartisan issues that are common sense and everyone agrees, we should address. They still work together when and where they can. But right now, one of the first things they have to deal with is the spending bills for fiscal year 25. I think people know usually Congress is finishing the annual spending bills at the end of the year in December. They didn't do that last year. They had a big bill ready. They had a lot of bills in it that for things that they, pretty much hadn't done all year long that they needed to work on, fixing Medicare physician reimbursement, extending telehealth coverage. All this was wrapped up. And then the package fell apart at the 11th hour. So they kicked the can down the road till March 14th. So now the new Congress has until March 14th to figure out how they're going to dispense with FY25 funding. Are they going to do a continuing resolution, just keep everything the way it is? Are they going to do what the Senate had proposed and provide modest increases for medical research and public health? Are they going to say they're having a hard time reaching agreement and potentially shut down the government, over the weekend until that pressure mounts for them to make a deal and get something done? But we'll know on March 14th, they have to work on that. At the same time, they're starting to work on fiscal year 26, the next appropriation cycle. Just because it's taken them extra time to finish the work on the current cycle doesn't mean that the next timeline gets pushed out. It's still happening. October 1st will still be the new fiscal year. So we're seeing them start work on FY26 appropriations. If they finish everything on March 14th for FY25, expect them to very quickly start pivoting to FY26. And at the same time, they're working on something called budget reconciliation. This is when you might have seen in the news, they're talking about potential cuts to Medicaid, CHIP, SNAP, student loans, these big kind of entitlement programs. That's through this process called budget reconciliation. So what happens is that the House and Senate, the same way that you think of your own budget, set revenue and spending goals. And then they have to write, other bills to line up with meeting those goals. So the Senate has taken a kind of an incremental approach. They're a conservative Senate, so they've said we're going to shift some money away from things like education and healthcare. We're going to shift it to things like defense, veterans, and border security, but in kind of an incremental way. The House has taken a cut everything approach. And before they can move forward, though, the House and Senate have to first compromise. They have to find a set of numbers that they all agree on before they can even start deciding what programs they're going to consider either plussing up or cutting. They're not going to really focus on this until after March 14th when they finish the spending bills off. But if they don't reach agreement, there's nothing that says they have to do budget reconciliation. If they can't come to agreement and find common ground, then the process will kind of grind to a halt. They don't have anything done by the time the fiscal year ends, they miss their chance at doing the bill. But there'll be more news on that. But that's where this talk about potential cuts to Medicaid and CHIP comes in. It's not part of the appropriations bills or the annual spending bills. And then this year is going to be a big year for healthcare legislating, like the chronic care bill I just mentioned. There's a lot of trains leaving the station, a lot of things they're going to be working on that are healthcare related. One, of course, is PBM reform, fixing how We do healthcare and work with benefit managers and pharmacies and all these middlemen.
What's
That's been
what's
kicked.
PBM stand for?
Pharmacy benefit manager. Good question. We use a lot of alphabet soup in DC, so this is pharmacy benefit manager reform. There was a time where Congress had believed vertical integration, connecting doctors with health plans, with hospital networks was going to make everything cheaper, economies of scale. But even as those connections have occurred, the cost of healthcare has gone up. So Congress has now said we can't pay more for worse outcomes, so we need to take a new look at this. But this is going to be done in a bipartisan way, and there's going to be lots of proposals floating around about just how to redo healthcare or look at networks and connections in a new way. They're also, the National Institutes of Health is due for a reauthorization. They reauthorize programs like NIH, which does medical research every 5 years, but this is their time when they modernize as well. Has science and innovation moved forward? Is the law and the system outdated? What do we need to update? What can we do better? Do we need to train more young investigators? They'll do this process, but then they'll also bring in other healthcare bills probably too, things related to the CDC, things related to the FDA, things related to Medicare and Medicaid potentially. This will come along with it. And then there's an even bigger package, something called Cures 2.1, which deals with all these healthcare agencies too. We dealt with research recently, but also how do we do things like reform coverage and access or reform coding and reimbursement so that breakthroughs in medicine get to people more quickly? Are the FDA and are the Centers for Medicare and Medicaid Services working as well as they can? And once again, if you say, well, geez, I don't know what's going to happen, or the process will have to be bipartisan. Nothing can get done without Democratic and Republican votes. So whether it's PBM reform or NIH or cures, it's not a tug of war. It's not one side or the other. It's only those things where everyone comes together and finds common ground that can move forward. And your members rely on your input to figure out what the best ideas are and where they should be working. Next slide, please. So let's do a little bit of a recap on 2024 advocacy, which was, quite successful. NIH, the National Institutes of Health, is funded at $48 billion. That's billion with a B. That might sound like a lot of money for research, but remember, they use this money to study every single condition under the sun, Alzheimer's, aging, sleep disorders. So once you start spreading it around, there's a lot of portfolios that could use a little bit more. And no leading organization would say we're funding enough medical research right now. We have something called pay lines. They're about 10%, which means 1 in 10 research proposals from leading academic centers, hospitals, or physicians you may even know get funded. 1 in 10 is not good enough. More money, the high tide would raise all boats, more research would get funded. The Centers for Disease Control and Prevention is funded at about $9.2 billion annually. And of course, I think as people know, there's an emerging conversation about how do we do more in chronic disease. That would probably very clearly impact the CDC. The Senate and House have not finished their bills off, as we just mentioned. The Senate has proposed modest increases for these programs, NIH, CDC, Defense Department funded research. The House has, not provided the same kind of generous, but also said, maybe we should look at reorganizing some of this stuff and making it better. These are active discussions and ones that, medical professionals would know a lot about. But the important thing is that Congress and your elected officials understand there's more that can be done for sleep. We don't have great work in time to diagnosis. We don't have all the cures or treatment options we want. Them having this information makes them better understand where they should invest these resources. There's a couple of notable community items as we continue to have a strong voice. We did a very successful appropriations sign-on letter for the FY25 process, all that language that's pending right now as they work to complete the bill. 35 representatives joined, but that letter was only open for about a week, given how convoluted, their work was this year. So in 1 week, 35 members were able to sign on. It's a very big number for a very short window, but a testament to the strength of the community's voice and all of your outreach.
Yeah, just a huge thanks to everyone. I think this community is so special in our outreach every year. I think we've kind of impressed Dane and our representatives in DC how much we mobilize, and we've mobilized over the last 6 years, I believe, through this letter. So Yeah, so just huge thanks, everybody.
And another part of Democracy in Action, folks might remember for Department of Defense research, which is different from NIH. NIH does research into everything. The DoD only does research where Congress tells them to do research. They've been doing sleep research since 1999 because the community has made it clear that it's an important part of healthcare research and medicine. And for the FY25 defense bill, sleep disorders and restriction are listed in the bill for research once again. There's only about 35 conditions that are listed. Sleep is one of them, and sleep is listed because senators put it in the bill. They only put it in the bill because they heard from constituents that it should be a priority. And then I will hand it over to Julie to talk a little about the Sleep Act. And I don't know why I just tried to advance the slides because I'm not the one running.
Thank you, Dane. Yeah, so we really initiated and gained momentum for what we're calling the Sleep Act last year. So what is the Sleep Act? The SLEEP stands for Sleep Leading to Enhance Epidemiology and Public Health Act. Dr. Michael Granier, you might be familiar with, helped us create an acronym for our bill. And it's really to establish a coordinated effort across the health and human services, focus on sleep education and awareness. It's been really striking to see that there's currently not really a home for sleep awareness at the CDC or at HHS in general outside of NIH, right? So we've had great progress with NIH and sleep research at NIH has been well funded, but how do we translate that into public awareness? I think we often talk about those delays to diagnosis are so long for people with sleep disorders. And, often we talk about the fact that the majority of people living with sleep disorders aren't ever diagnosed. That's pretty scary. In addition, sleep is such an important foundation of public health in general, even beyond sleep disorders, right? Sleep impacts everybody. And so the fact that there hasn't really been a sleep public health effort, a funded program, a coordinated program to promote sleep as an important pillar of health and also sleep disorders awareness as an important message is really why we are so excited to be putting this bill together. So I believe this picture is from a Hill Day actually in November of 2023 when we got our first representative interested in co-leading the effort. And so that was Congressman Danny Davis took the lead outside of Chicago, I believe, in Illinois. And his office has been wonderful to work with. And this past year, we've been really looking for a Republican co-lead office. And, we hope to be getting really close to getting a Republican to co-lead this effort. Yeah. So let's see. I think that's a little bit about the bill. Dane?
Yep, and of course, I would just say if you are close with your House representative and they're a Republican, we'd love to have a chat with them and you about the Sleep Act. So just let us know. Another example, like I said, of us having a collective voice is our committee instructions. So just to close the loop on this, folks might remember we do these sign-on letters about spending items and what we call report language. The members of Congress open them up. They ask their colleagues to join. We reach out to a bunch of House offices and our members and say we think it's important that you join this letter. Last year, 35 folks joined the letter and said we need more language directing additional research in sleep disorders and also more public health activities in sleep health and sleep disorders. And then by doing that and getting those signatures, the language ends up in the spending bill. It's now currently pending. So this is the actual language from FY25 that ended up in the bill because members wrote the Dear Colleague and sign-on letter, and because you took an effort to reach out to your members and ask them to join it, and then so many members joined it, there was enough support to have it included. So this is the language that they ultimately included in the for sleep health and sleep disorders in the spending bill. So they add the money and then they also tell them how to spend it. And this is what they're doing in regards to sleep. But once again, as a result of your outreach. Next slide, please.
Yeah, Dane, so this is part of that pending bill right now that they still have to finish for, you said by March 14th,
Yep,
hopefully? Okay.
exactly. And there's no and even though they can be far apart on how much money to spend or what to do, they're not far apart on whether or not they should agree on this kind of report. This is a non-controversial item, has nothing to do with why it's taken them so long to finish the process, but it's there waiting to be finalized, just like the money for NIH or anything else. So what is the climate on Capitol Hill right now? As I mentioned, it might seem divisive, but that's because the divisive issues are always the ones that attract attention. The system still works wherever everyone agrees, and we have kind of bipartisan consensus. But like any administration and like any Congress, there's always going to be challenges and opportunities. The challenges right now have to do with, differing opinions on how to handle some of the key programs we work in. There's something about, how much money should go to medical research and how much support should go to this new entity called the Advanced Research Projects Agency for Health that does projects kind of like how the Defense Department does. So we, of course, would be very much in the more research camp and more development, more breakthroughs, more treatments, but not everyone is on the same page. And of course, new members are figuring out where they should be on some of these issues. There's differing opinions on CDC. There's talk about, geez, what should the CDC's kind of core mission be? But one thing that's reassuring is almost everyone seems to agree more work needs to be taking place in the chronic disease space, particularly for pediatric chronic conditions, but chronic conditions that affect everyone and the country writ large. I think Julie did a nice job of mentioning in the Sleep Act that sleep doesn't have a home in public health because it's not part of the law. It's not just done by what's most prevalent or what's most severe. It's done by how the law has kind of stacked up over the years. And that doesn't include sleep, but it also excludes a lot of other chronic conditions. There's a changing tone on that right now. There is lots of rhetoric about cutting funding and what that could mean for things like Medicare and Medicaid. So, of course, making sure members understand these are kind of key programs and also key patient protections helps them make decisions in these debates too. And then there is this new Making America Healthy Again commission and effort. It is focused on chronic disease and new opportunities to invest or address chronic disease. But there's also questions about certain things like the safety and efficacy of using stimulants in children. Once again, having an expert voice from physicians and having a patient voice helps inform members about how they should handle policymaking initiatives like this. And Julie, I'll invite you to contribute if you have anything to add on some of these challenges and opportunities items.
I mean, I just think it feels really scary when you hear something like, that all at once stimulants are of concern, and when our population obviously relies heavily on stimulants, even SRIs, I think were even included in some of this messaging. And I guess, you always try to point out to me what's sort of like rhetoric maybe versus what actually happens, but I just don't even like the tone. I think it's putting the tone of a lot of the messaging that's coming out. Like a lot of these things are already very invisible and already put people in, like, I don't know, a defensive place of, there's a lot of stigma already around invisible things like sleep disorders or mental health and mental health conditions. So some of this questioning feels like very personal, and it's very hard for me to see the opportunities right now. So I'm glad that I guess you can see some. I mean, that there is sort of an openness to new ideas is exciting, I guess, but I worry a lot about just whether or not, like, these cuts and this questioning, what it means for like people's real like healthcare.
Yeah. And I think what's important is how do you advocate? So to close the loop on that, Julie, for example, with any of these cuts, your members of Congress are looking to their constituents and the squeaky wheel gets the grease. So if you're concerned about potential reductions in Medicare or Medicaid, tell your members of Congress about it. That will influence where their support lies and whether or not they go along with proposals like that. And then in regards to some of the rhetoric coming out around HHS, and just take the Make America Healthy Again Commission as an example, they're not going to be making rules and laws just by fiat and saying this is what we're doing moving forward. There'll be a process. They're designed to come up with recommendations and a report. So what they talk about or what they say about stimulants in children or what they say about chronic disease is going to be somewhat transparent. You can provide input as they come up with these recommendations, but then the recommendations are also sent to Capitol Hill and to Congress. Congress ultimately has to turn them into law. And if you are telling your members, this is what we should be doing on the chronic disease front, or this is what the sleep community needs, that will shape what they end up doing and passing into law as the process goes through Capitol Hill. Even if you think HHS might not listen to you, your senators and representatives who will end up having a voice in exactly what ends up getting done will listen to you. And the old adage is the administration proposes, Congress disposes. So they can have rhetoric and they can say things, but ultimately, when it comes up to policy making, it's going to be your senators and representatives that make those decisions. They can make them with your input or without it. It's much better that they make it with your input and with your perspective. So I'm ready for the next
Okay.
slide if you are, Julie.
All
But
right. I know, but I just think that like things like NIH haven't been, like NIH has been bipartisan, like well supported for a while now. So it's just even that it's being questioned, I think just sets a different tone. That's all.
absolutely. But it also speaks to the importance of why you would raise your voice now at this point. You wouldn't just assume that NIH will always get an increase or will always be taken care of. Make sure, particularly if you have a new member, let them know why they need to support medical research. So we will have opportunities in 2025 to make your voice heard. In the very near future, we're going to have an FY26 appropriations letter where you can once again ask your members to join it and then join it by adding language to those bills and having that language included in the process. This will include more direct links between public health and patient care and the public health service with sleep, and also about how to keep moving research forward. We do want to work with you to find those initial co-sponsors of the Sleep Act. More Democratic support is good, but Republican support is good too. Only those bipartisan ideas are going to work. Your members are going to become champions because they've heard from you about this. So not because Julie or I talked to them, but because they know they have constituents that are impacted. So we'd very much welcome working with you to find those initial co-sponsors and people who are going to lead the Sleep Act through the legislative process. And then we always have opportunities for you to share your story. You learn a lot through the Rising Voices program, but also there's an audience on Capitol Hill that we can share those stories with. We do testimony every year, and we often collect stories that we can submit to Capitol Hill that show the patient experience. We like sharing those with new members, and we like having coordinated advocacy events that help us get the word out as well and are sometimes timed up with other awareness activities. So, Julie, I'm not sure if there's anything else you'd want to add here.
Well, just if you've already been in touch, like from the past couple years with your representative's office from the sign-on letter, I do think you could always be sharing updates with them. Like we always say, it's important that we stay in contact with them, not just always when we're asking for something. So if you have, something, any recent research articles or, there's sleep awareness activities that you're involved in, especially if they're in your local community, or a new sleep center was recently created in your area, and anything like that. I think you can always go back to your representative's office, let them know about what's happening in the sleep community generally, or even more specifically in your local community. I think that's really great. So, for example, we're doing a Sleepless in Hollywood event about sleep and sleep disorders here in Los Angeles. So, of course, I sent my representative's office the invitation for the event, just to let them know it's happening in their, district. So, I just think, we can continue to build relationships. And I just put this point about how's your sleep here, because I know this feels like such a divisive time, but everyone sleeps. And I think it's just a really wonderful way to remember. And when we do talk to our representatives' offices, like we like to say, start with this question: how's your sleep? Like ask the staffer you're speaking to how they're sleeping. And it's just a really good reminder, I think, to them that our cause isn't just our cause, it's their cause too, because everyone sleeps. Um, yeah,
Next slide,
but
and that's
Yeah, I
Sorry,
was
just
going to say, we will have the letter opportunity later this spring. We never know exactly when that opportunity will come. I wish I could say, like, get ready March 15th or March 30th. We never exactly know when the window of opportunity, as Dane mentioned last year, I think we had only about a week window of opportunity. So we get everything lined up. And then as soon as we can, we put out that we call it an advocacy action alert. So we email that to our listserv and put, of course, across our social media to that's the key time that we ask for everyone's support to try to get their representative signed on to the sign-on letter. I just wanted to mention that we have a really special project running right now in the shifting political landscape, how that impacts LGBTQ plus community members. So we actually collected data over the last couple of years, and we recently just reopened that survey to get new responses now that come in after the election and in this new political landscape that we're in. And so we'll be able to compare the results from the initial survey with the results now with what's happening more broadly for the LGBTQ plus community. So this is open to any members of the LGBTQ plus community. You don't have to have a sleep disorder by any means to participate. We just want to hear how, in general, the community's sleep is impacted by what's happening more broadly politically. So please help us spread the word about this opportunity. The deadline is March 15th to get responses in to have them be part of a analysis that one of our board members is conducting in hopes that we can present some of this data at the sleep meeting in June. So we're really, really excited. A huge shout out to our programs manager and our board member for working on this effort. And it's just one way that we hope that we can be understanding and supportive of this community and help to show some of the impacts on sleep that some of the political landscape is impacting.
And I think, as Julie noted, sometimes you can feel a little overwhelmed, and what's happening in Washington can seem daunting. But I want to remind everyone kind of strategically that we partner with many other organizations on these broader issues. So there's a group called Research America that works on all the research funding. So it's not just us saying you need to fund more for NIH or don't mess with medical research. It's hundreds of organizations, and we lend our voice to that chorus. Similarly, there's a group called the Council of Nonprofits. So when there's things about, nonprofit tax status or how groups support research or work on patient care issues, there's all the nonprofits work together on those types of issues. And then there's even a group called United for Medical Research, and the Ad Hoc Group for Medical Research that has a great new tools and resources one of them is called NIH in your state. So if you look up your congressional district, it will tell you exactly what research is going on locally, because your members might care to know just how many of those federal resources are creating jobs and working to find cures, back in their district. So the important thing to remember here is we partner when it comes to Medicaid cuts, research funding, these broader issues. We partner with many other organizations to make sure that we have a collective voice and the safety and strength in numbers. But none of these other organizations are going to be talking about the issues that are specific for the sleep community. We can talk about the high tide, which is more money for NIH, but they're not going to be talking about the need to make sure that those resources are going to sleep health and sleep disorders. We're the only ones who can carry that message. So with our members of Congress, it's very important that we speak our own truth and that we talk about the things that hit closest to home for us. So rest assured, on the bigger items, on the 30,000-foot level issues, the community is joining with many other organizations to work on this. But we're the only ones who are going to be talking about the opportunities and challenges that are specific to sleep. So we need to be that voice moving forward. Next slide, please.
Thank you, Dane. And I just wanted to have a reminder about staying grounded and rested during this time. I know that everyone, might feel a little on edge. And this is a wonderful article I just wanted to highlight here by our expert advisory board member, Dr. Callie Cyrus. And we've just highlighted this on our socials yesterday as well. And what I love about Dr. Cyrus's article is really pointing out that fear is natural, and it's a really good natural thing that happens to us, but how that can actually add stress and damage to our body. So I'm sure, folks have been seeing this message across many, a lot of people have been talking about this, but just wanted to add a reminder about, of course, we want to stay in touch, we want to stay in the know, but what to do with those fears when they do come up, that even though they're natural, how to manage them, and also how to stay connected to our community. Community is so important, and this community is so important, and making sure that we're still able to um, uh, cultivate joy even during difficult times is really, really important. And also, of course, prioritizing rest because we're Project Sleep. So, check out this article if you haven't. I just thought Dr. Kelly Cyrus did a really amazing job with it, and just wanted to send us off with a reminder of being careful how much we consume every day. And just a huge thanks to our amazing community. That's you guys. Thanks for being here. And we hope to continue to work with you now more than ever to continue to raise our voices up. And please check out make sure to look for our emails with opportunities to be that are specific to the sleep community. And then, of course, those coalitions, those broader coalitions that Dane mentioned, they have opportunities, of course, for broader issues to be talking about the importance of medical research and healthcare, care and access issues as well. Any last thoughts, Dane?
I was just going to pick up on something you said, Julie. I know you're a great icebreaker when speaking to congressional offices is asking the staff, how was your sleep? In these times with the headlines and with everything else going on, I know I'm in DC, but I've just started asking pretty much everybody that I know and see regularly how they're sleeping, because that's just so important for everything, how you're managing stress, how you're managing your own health, how you're dealing with self-care is just such an important question for anyone these days in these times. How are you sleeping? How is your sleep?
Yeah, it is. And being there for each other. So, all right. Well, thank you, Dane, for helping us make sense of some of what's happening. And thank you, everybody, for tuning in. And we'll see you hopefully again soon.